Welcome to this installment of Gateway Today. I'm your host, David Cash Vasquez, and Gateway Today is that show that talks about all things Gateway Community Health Center, and today's show is no different as we take a look at some of the existing and some of the new things we're adding on here at Gateway Community Health Center. First, we'll talk to Jennifer Garcia, our Eligibility Assistant Worker 2, about eligibility and registration and how patients can qualify for the marketplace as well as state benefits. Then we head over to our radiology department as we get a chance to catch up with Jalissa Gamboa, our radiographer, along with Danielle Haddam, our resident sonographer, who run us through the process patients will experience once they get into imaging. Then finally, it's a new addition to the Gateway Community Health Center family of clinics. We're talking about our brand new mobile clinic that we just added on to our fleet, and we're excited to share and talk all about it. We got a lot of show to cover, so sit back, relax, kick your feet up, because another installment of Gateway Today starts now. Welcome to this installment of Gateway Today. Well, in this episode, we get a chance to head over to our eligibility and registration department to talk to Ms. Jennifer Garcia about how patients can qualify for both federal and state benefits. Check it out. Well, in this segment, ladies and gentlemen, we wanted to answer a question that we get oftentimes here at Gateway Community Health Center, which is, how do I qualify for services here at Gateway? And I thought it would be proper that we bring in somebody from our eligibility and registration department. Her name is Jennifer Garcia, and she is also our eligibility assistant worker 2. And 2 meaning she's not a 1, because 2 means you're certified, right? Okay, so tell me about that certification, Jennifer.
So I am a certified application counselor with the marketplace, and also I am a application assistance navigator for state benefits.
That means you know exactly what we're talking about when we ask you, what can I do to get qualified for the health insurance marketplace, commonly known as Obamacare, right? But healthcare.gov, as many may know, also you help our patients find coverage in that area, right?
Yes, correct. So we do the application assistance. If they are eligible, we do compare plans with them and see if they qualify. We will assist them in choosing a plan that best fits their needs.
And kind of walk me through that process with the marketplace. When a patient comes in, do they have to pay? Because I know a lot of folks are probably going to ask that. There's probably a charge for that, but this is free, right?
Yes, it is free to the community. We do not charge. It's free application assistance that they receive.
Now, I know there's certain deadlines and certain criteria that have to be met when qualifying for coverages on the marketplace, but there are some special circumstances where people, even after the deadline has passed, can still find coverage, right?
Correct. We do have special enrollment periods. And if you meet any of the life events, you can also be eligible, and you can come in and we can assist you to see if you qualify for any of those special life events.
And life events, when we start talking about that, that could be a new addition to the family, right? Somebody was born, right? A baby.
Marriage, divorce, you lost coverage through your employer for whatever reason, you can no longer afford it and you lost it. We can help you get that assistance.
So special circumstances, special life events would allow them to get that coverage. And with that, let's switch over to the state, right? You also help with state benefits. What are those?
The state benefits that we assist with are Medicaid, the CHIP program, food stamps, which is our SNAP, and TANF benefit.
Okay, so let's talk a little bit about that. Most people, walk me through that process, because most people their family may be growing. They may not have health insurance from the marketplace. This is help from the state, right?
Correct.
What does that process look like? Let's just say I am somebody that is looking for coverage. You would help find those options for them through the state, right?
Yes.
What does the application process look like?
So you would come in, we will assist you in filling out the application. We assist you in gathering all your documents, submit it to our state worker, and we do have a turnaround of about 3 to 4 days to receive eligibility.
And you will contact the patient to let them.
Yes.
Okay.
Once we have an eligibility result from our state worker, we contact the patient directly.
And once the patient qualifies for services or for coverages, then they can automatically start seeing one of our providers or start receiving the services.
Yes, correct. We do provide the eligibility information, and it is immediate, and you can schedule an appointment to see the doctor, specialist.
Awesome. And finally, this is the fun question. How long have you been doing this for here at Gateway?
I've been with Gateway 14 years, but Marketplace, I've been doing it for 11 years, and also state benefits, 11 years.
What is it about Gateway and this particular role that you've been doing for so long? Why do you keep doing it?
Because I love assisting the community with the programs.
That's awesome. Well, I think oftentimes the eligibility and registration department don't realize how they're changing lives and helping our patients, and the work that you're doing is really appreciated, Jennifer. Shout out to you. I know you're passionate about the work that you're doing and extremely knowledgeable. And so if you want to find out whether you qualify for those services, you need to get over to gatewaychc.com. Make sure you click the button to become a patient. What will happen from there is once they actually do that, your department reaches out to them, right? Awesome. And you will get a chance to find out if you qualify for those services with help from the federal or state government. And so I want to thank you for your time and all the work that you're doing again. Her name's Jennifer Garcia. She's the eligibility assistant worker 2 right here at Gateway Community Health Center for all of your questions regarding eligibility and registration. Well, our thanks goes out to Ms. Jennifer Garcia, a hardworking employee here at Gateway Community Health Center. Shout out to her and everybody at registration and eligibility doing everything they can to help our patients receive easy healthcare access and services right here at Gateway Community Health Center. That said, speaking of services, we're headed over to radiology, where we're going to get a chance to talk to Ms. Jalissa Gamboa, our radiographer, who will walk us through the process of what the world of X-ray and radiology is all about. Check it out. Well, we find ourselves in the radiology department here at Gateway Community Health Center. In this segment, we are featuring our X-ray machine, a huge investment that Gateway has made, and our radiographer, Ms. Jalissa Gamboa, has joined us on the program. I forced her to take a break and join us, but Ms. Gamboa, as a radiographer, we were kind of talking off camera how you kind of fell into this career by accident, but tell me what it is that you're loving about X-ray radiology. What is it that you love about what you do?
Well, I feel like I have a purpose with this job. I feel like I'm helping, I feel like I'm making a difference. People come in here sick, needing help to see what's going on. They don't know what's happening. And I think providing these images really opens up for their exams, their treatment.
Yeah. And I love that you say that, because that's what we do here at Gateway. We want to help our patients, right? And I love that you're finding that love within the work that you're doing. When you start to deal with patients, sometimes patients may be a little uneasy or a little scared when it comes to X-rays. Tell me about that. Tell me about that process. How do you ease a patient in when you're going to take these X-rays of their body?
First, I introduce myself. I ask what exam they're having. I let them know step by step what we're going to be doing. Offer them protection with the lead shields, anything to keep them at ease, keep them more comfortable.
Yeah. So really, it's a calming of the nerves. And typically, how long do X-rays take? I guess, is it kind of like depending on the procedure or the type of photos that you're going to be taking?
It depends on the exam we're having done, and on the patient's condition. Some come in needing a little more help than others. And even though they may need to take their time, it is a pretty fast exam experience.
Yeah. So that was actually going to be my next question, which was that we can X-ray pretty much anybody from kids to adults, right? That's who we.
From days, weeks old to 100 years.
Wow. And so in that process, walk me through that. Once the X-ray has been taken of the patient, what happens after that? With the X-rays, what goes on for the patient after that?
I send the images to a radiologist. The radiologist reads them. It takes about 2 to 3 days for us to get them back. I put them in the patient chart, and there their provider can speak to them and talk to them about the results.
Awesome. So once you take those X-rays, it then becomes part of the physician's job to sort of read them, relay the results to the patient, and then from there, any other processes will be taken. And then finally, just tell me about, as you think about radiology and the work that you're doing, what are you most excited about here at Gateway as we sort of grow this department? Now that we're going to be bringing in mammography, we've got ultrasound and X-ray. What excites you the most about the whole department?
Well, like you said, we're growing. I think that is the main thing. That's a lot more access for patients, a lot more appointments, because in some of these other places that these exams are taken, sometimes it's hard to get an appointment or long waits. And here they can feel more comfortable already at Gateway, set the appointment, and know they're in good hands.
Well, my hat's off to you, because I know you're passionate about your career. I know you're passionate about the work that you're doing. And so I'm just thankful to have you as part of my team and to talk to you today. So her name is Jalissa Gamboa. She's our radiographer here in our radiology department here at Gateway. If you want to find out more about radiology, X-rays in particular, make sure you visit gatewaychc.com. Hey, our thanks goes out to Ms. Jalissa Gamboa, our radiographer, for walking us through the process of what it's like when you come and take an X-ray here at Gateway Community Health Center. We're staying with radiology as we head over to ultrasound with Danielle Haddam, but first we're going to take a short break. More Gateway Today on the way. Stay close.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. Well, before the break, we said we'd head over to ultrasound with Ms. Danielle Haddam, and she's going to walk us through the process of what patients can expect when they come over to Gateway to take their ultrasound. Check it out. Hey, we're back here on Gateway Today, and we are still in our radiology department talking to Danielle Haddam, our sonographer, who is a resident part of our radiology department. Danielle, thanks for being a part of the show. And one of the things we wanted to show all of our viewers was what really happens here inside our ultrasound area within our radiology department. And so Danielle's obviously our sonographer, and she's the perfect person to talk to. So Danielle, thank you so much for joining us. How did you kind of get into ultrasound? Like, I know off camera we were talking about what you were kind of thinking about, but what was it that made you gravitate towards ultrasound?
I always knew I wanted to do something medical to help people, and I didn't want to be in school for so long, so many years in school. So I decided to do ultrasound because it's a pretty quick program and interesting job.
Yeah. What is it that you kind of get attracted to, or what is that one thing that kind of sticks out? I know when I've talked to dentists, they've told me, well, I like doing extractions. You talk to doctors, I like doing vaccines. For some reason, they like putting needles in people. But for you in ultrasound, what is it that kind of you like the most about your position here?
I mean, I like helping the people, but then also knowing that no one else can read or see what I'm seeing on my screen. when patients are looking at the screen and they're like, I don't understand what you're looking at. It just makes you feel like, oh.
More than anything, I think that's a special quality because you actually know what you're looking for. So kind of walk me through that process. You know, I'm a patient, I'm coming in. How do you deal with like nervous patients that are very new to ultrasound or don't know what that process is? How do you, as a sonographer, welcome in the patient and get them ready for an exam?
Explain the procedure to them, how long it's going to take, when to expect the results and all of that.
And typically when we start looking at, and you're doing the exam, what is it that you can examine? Like what parts of the body is it pretty much anything?
It's pretty much everything, yeah. We could do anything from like abdomens to OBGYN, veins, vascular, a little bit of everything, thyroid.
Awesome. And so once the exam is complete, because I know a lot of folks kind of wonder, well, they did this exam, I don't know what's going to happen next. To walk me through that process. So the exam has been complete on the patient. What happens next after that?
So once I finish my exam, I do my preliminary report, which I send to the radiologist, and then he finalizes and sends the results to me, and then I forward them over to the doctor.
So once the doctor gets the results, he'll basically, very similar to X-ray, will convey the results to the patient. And then after that, a patient may need to come back for a follow-up if something's unclear, that kind of thing. So you deal with the patient again, right?
Sometimes, yes.
Okay, awesome. And finally, this is kind of like the fun question. You know, what are you excited most about with ultrasound as a sonographer, and kind of all the things that we're doing here at Gateway? What are you excited most about?
Hopefully growing the department.
That's awesome. Yeah, well, you know, I'm glad to hear you say that because this is one of our biggest growing departments, as now we're adding on mammography. So X-ray, mammography, and ultrasound are all part of the process, just a way that Gateway is expanding their services. She is our resident sonographer here at Gateway Community Health Center. Her name's Danielle Haddam. If you need more information on ultrasound and want to know more how you could take advantage of these services, visit gatewaychc.com. Thanks, Danielle. Hey, our thanks goes out to Ms. Danielle Haddam and all the team over at Radiology for all the hard work they're putting in for our patients. And if you want to find out more about radiology, make sure you get over to gatewaychc.com to become a patient or set up your appointment today. That said, we're excited. We've added on to Gateway Community Health Center's fleet. Our family of clinics continues to grow as we take a walk through our newest addition, our mobile clinic that will service all the women of South Texas. Check it out. All right, ladies and gentlemen, we are here outside our central clinic here at Gateway Community Health Center, and I'm excited because today's a great day for us. We've actually added on a new clinic to the list of clinics that we have, and it's all brought to you by our friends over at Mobile Mission or Mission Mobile Medical. Here with me, Bill Horn from Mission Mobile Medical, to talk a little bit about what this means for our patients and the entire south of Texas. And Bill, thanks for being here. Thanks for joining us.
Yes, sir.
Tell me a little bit about your experience with Mission Mobile and what it is that the company does.
Okay, at Mission Mobile, we buy used RVs and convert them into mobile medical units.
Okay.
We bring them in, we take out all the commercialized furniture and fixtures, and we strip it down to the studs. And from there, we have a team of guys that go in and just upfit it into, we make dental offices and medical clinics. We also have methadone clinics that we provide vehicles for.
Nice. Well, that's what's beautiful about the mission and the work that's being done with Mission Mobile is that you could take what was previously maybe a personal RV and then turn it into a clinic on wheels. And I love this about what your company does. Now, tell me also about the delivery of these vehicles. Once they get over to the actual organization, what have you seen the expression and mission become once they're actually being serviced through the clinics?
The whole experience is amazing. People are excited to see this thing roll into town. The employees that onboard after I leave, they go out and they're beside themselves.
Yeah.
Being able to get away from the hospital, go into communities where people are, in a sense, afraid to leave their neighborhoods. So you are the outreach.
Right.
We provide the unit, you provide the service.
Right.
And
well, you know, I love that because, you know, with the help that you all have provided, we're able to change lives. We're able to save lives. We're able to make lives even more healthier. And that's what this whole mission is with Gateway, is to provide healthcare for everyone. But this will allow us to do it in an even bigger way. And finally, Bill, what I really want to ask you is for you personally, what has the experience been like for you personally to see that joy, see that accomplishment? You drove into town to bring us our very own vehicle. You've seen how happy everybody is.
Yes.
What does it mean for you?
I've been on the road for 4 days. I came from Greensboro, North Carolina, got into Laredo last night. The smiles, the reception that I get when I'm delivering these is out of this world. It's life-changing. To help people maintain a quality of life is of the utmost importance. And if we can partner with you to do that, that is our goal. That is our job.
Well, you know, I think every one of us has a small part to play in the healthcare and the betterment of other human beings. And you're doing that with the work that you're doing and the company is doing over at Mission Mobile Medical. And I just can't thank you guys enough. We're excited. So we're going to join our director of nursing inside the mobile clinic so we can kind of take a look and find out what the mobile clinic is going to be doing while it's on wheels here after we come back from break. So stay close. More Gateway Today on the way.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Hey, welcome back to Gateway Today. Well, before the break, we got introduced to the brand new mobile medical clinic from our good friends at Mission Mobile Medical. And so now we will head inside so you can get a sneak peek at what patients can expect once the medical clinic gets on wheels and gets moving and gets going, as we talk to our Director of Nursing, Jose Alfredo Santos. Follow me, let's go. All right, we are inside the newest addition to our clinics, the new mobile medical clinic with our Director of Nursing, Jose Alfredo Santos, Freddie, as we call him here at Gateway. And Freddie, you know, I thought you would be the perfect person to interview for this because you have been dealing with our current mobile clinic and now you got a brand new toy, right? And
Yes,
so
sir.
tell me a little bit about what the mobile clinic offers to our patients across South Texas.
Okay, so thank you, David. And again, today's a great day here at Gateway. This is our second mobile, as you mentioned. Our first mobile offers medical services, and this is through some grant, some fundings. We were able to obtain this mobile unit to provide women services.
Yeah.
So this is going to be strictly for women's services, such as women exams, pap smears, and other procedures that we're going to be able to do.
And you know, I want to ask you about that, but what specifically, this also helps patients like with transportation issues.
Yes.
I guess,
Yes.
and the ability to get to a clinic now.
Yeah.
This is a clinic on
Yeah.
wheels, right?
Yes, it is. It's a clinic on wheels. So there's some barriers, and transportation is a barrier for some of our patients and some of the patients in the community. So with these mobile units, or specifically this, so we'll be able to provide these preventive preventive medicine, again, like I mentioned, well women's services, breast exam, pap smears, and again, other procedures that we'll be able to do, but take these services to them instead of them coming to us. And again, if there's a transportation issue, this will help us. So what we're going to do, we're going to be out in the community, and not just in Laredo, but the counties we serve, Webb County, James Hogg, and Zapata County. So we'll be out there, keep an eye out, look at our website. We'll be putting out information and being out in the community, wherever the need is at, that's where we're going to go.
Yeah, absolutely. And if you are interested in learning more about those services, as Freddie mentioned, make sure you stay connected with us online. And finally, Freddie, you've been here with Gateway. You've kind of seen the expansion of services. Yes. And when we talk about this new mobile clinic, how do you feel knowing that we're going to be able to offer these well women's exams, this expansion of women's health services for the women in our community? Your wife, your mom, the women in your life. What do you feel today?
It's a push. Again, this is preventive medicine. You know, we want to catch things early, right? You catch things early, there's a better outcome. Better outcome. There you go. And so there's a better outcome. So this is a push, right? We want to make sure that our patients and the community are getting the services, these preventive services that are needed, much needed, right? So this is a Well Women is a yearly exam that should be done. Again, it's preventive medicine. So you want to catch anything early, right? To have better outcomes. So again, this mobile unit is great because we'll be able to take these services to the patients that otherwise might not be able to come to us or get these services done.
Well, I love it, man. I'm excited for you. I'm excited for Gateway, and obviously excited for our patients. And just thank you for all the work that you and the staff are doing. As director of nursing, I know you got a lot under your that you got to sort of put out there and handle. And so you're doing an excellent job, man. And so thank you for all the work that you're doing.
And in my short period here, which is 3 years, a little bit over 3 years, we've had tremendous growth. We've expanded so much with our new Westside Clinic, addition to a pediatrician, pediatric neurology, working on our Minesboro Clinic, and expanding our Shiloh Clinic. So tremendous growth. Again, this is for the community. This is who we are and what we do at Gateway. I always like to say that we can see anybody who walks in through our doors. Uninsured, insured, we'll be able to see you, and we provide an array of services, as you all know.
Man, well, you hit the nail on the head. It's healthcare for everyone, and I couldn't have said it better myself. He is our director of nursing, giving us a firsthand look at the inside of our newest clinic, Jose Alfredo Santos, Freddie, as we call him here at Gateway, right here on Gateway Today. Well, if there's a guy that is passionate about helping patients, it is Mr. Bill Horn and the entire crew over at Mission Mobile Medical for making our brand new clinic on wheels a success. Our mobile clinic is ready to go, and we cannot wait to get it all across South Texas to help all of our patients. And if you want to find out more about our mobile clinics or any of our other clinics, make sure you get over to gatewaychc.com, or you can also call 956-795-8100 to become a patient or set up your appointment today. If you want to catch a full rewind of this episode or any of our other Gateway Today episodes, make sure you get over to our YouTube channel, search Gateway Community Health Center, and don't forget to smash that subscribe button. Till next time, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.